So I'll be talking about the integrative approach to diabetes and cardiovascular disease. And when I think of the word integration or the integrative approach, I think about maybe attacking a problem from a couple different angles or maybe a couple different ends. And it reminds me of a story. Maybe you guys have heard of Dr. Smith and Dr. Jones, but I'm going to tell you about them real quick. So Dr. Smith was a psychiatrist and Dr. Jones was a proctologist. And they were very good friends. They had met in medical school, and then they did residency. Now they did different residencies, but it was at the same university. So they were good friends. You know, their families got to know each other. And when they went to set up practice in this small Midwest town, they moved their families there together, and they wanted to practice together. You know, they wanted to share overhead and decrease expenses. And so Dr. Smith and Dr. Jones set up shop. So they opened up their clinic, but they had to put out their sign. They had to put out their shingle, right? Well, this was a pretty conservative Midwest town that they moved to, and so they had to get the approval of the town council for their signage, right? So Dr. Smith and Dr. Jones, so they went to the town council and they said, hysterias and posteriors. Oh, that didn't go over very good. They came back and the town council said, no, we'll try something else. So they came up with manic depressives and anal retentives. No, that didn't work. They came up with catatonics and colonics. No, that didn't work. So they kind of banged their heads together and they said, we got to come up with something. So, they approached the town council with a lot of different ideas. They came up with loons and moons. They came up with freaks and cheeks. And finally, they came up with nuts and butts. But it just didn't fly. So finally, after a couple of weeks, they came up with something. Dr. Smith and Dr. Jones, odds and ends. Odds and ends. Okay, so if you go back to the Midwest, you'll see their practice. No, that was all made up. But the point of the story is sometimes when we practice functional medicine, we find ourselves at odds with some of our colleagues, maybe some of the traditional medicine docs. But in the end, if we really think about patient care and the outcome of the patient, and we really want to do no harm and have the patient turn out well, that is the kind of medicine that I choose to practice, which is integrative medicine. So there was a story to you guys, reason for you guys putting up with that story. So again, thank you all for being here. I'm excited that you guys are interested in medicine, but what type of medicine are you interested in? Or maybe you're interested in traditional medicine, maybe you're interested in functional medicine. You've heard a lot about that today. I would contend that maybe you're interested in both, and so I welcome you to integrative medicine. And so integrative medicine, to me, combines traditional medicine as well as functional medicine. And so for me to explain this to you, my lecture speech, 40 minutes hopefully or less, is going to be pretty easy if you can remember 3 letters of the alphabet. The 4 P's, the 4 D's, and the 4 S's we'll get to later. But the 4 P's and the 4 D's are what I'll start with. And so if you get this, then I've done my job for the day. And let's talk about the 4 D's. So I'm board certified in family medicine since 1991, been practicing in private practice in Placerville since that time. My wife's also a family doc. I truly believe in practice of traditional medicine with some caveats. But the 4 D's really exemplify traditional medicine. Diagnose disease and dispense drugs, okay? And traditional medicine is really good at that, and it's not necessarily drugs. Sometimes it's surgery, sometimes it's a referral to our physical therapist or our personal trainer, but it is some form of treatment. And in traditional medicine, and by the way, how many medical students do we have in the room here? Medical students, wonderful. And then undergraduates, a number of undergraduates, pre-med undergraduates, fantastic. So, we'll talk here at the end in the workshop at the end about, how you should go about learning how to do all this nonsense. But I really think there is something to be said for traditional medicine, and I'll tell you about that in a second. So diagnose disease, dispense drugs, pretty invaluable in certain circumstances. The 4 P's, let's prevent problems by promoting physiology. Okay, and so that's what we've heard about today, and in particular, you heard about the 4 S's. And actually, thanks to James' lecture, I think I'm going to add a 5th S, but I'll get to that later. Okay, so remember, the 4 P's and the 4 D's. I mean, that is it. I could almost end my lecture right now, but we really need to tell you a little bit more. Okay, so I'm going to tell you a story. So that's a picture of my dad. He was kind of being a goofball. I think those navigator glasses are kind of coming back, so he's somewhat in vogue. So my dad is now 85. I want to take you back, it's 6 years ago now, January of 2014. So my mom and dad, not in medicine, My dad worked for IBM. My mom was a professional volunteer. Yeah, she was like president of Eastern Seals and all that stuff. January 2014, they live in a small East Bay town, Alamo, you probably know, next to Walnut Creek, Danville. And they live in a little townhouse down there. I'm up in Placerville. My brother's up in Concord. It was a Thursday afternoon, January 2014. My mom was about ready to go to a dentist appointment, 2 o'clock in the afternoon. My dad was in the back room, kind of what they call it, his den or his study. And he had the little dog with him. Their little dog's name is Twinkle, little Shih Tzu. And that dog is like anywhere my dad goes, I mean, that's his little girl, right? We all know those kind of dogs. So Twinkle was, of course, right by Dad's side. My mom is walking down the little hallway to the garage, like, see you later, I'm going to the dentist. And all of a sudden, she heard this big thud. I mean, loud thud. Twinkle comes flying down the hallway. And it was one of those barks, you guys have animals, that something was not right. It wasn't like a happy to see you bark. And so my mom ran back to the den. And sure enough, my dad laid out on the floor, complete right hemiparesis, couldn't speak, facial droop. As I say, my parents are not in medicine, but it was pretty obvious to my mom that he was having a massive stroke. So she calls 911. Well, they're in Little Alamo. The Alamo fire station is not more than 90 seconds away. So by the time the ambulance gets there, the little neighbor Chrissy's calling me in Placerville. I make the 2-hour drive in about an hour and 20 minutes. My brother drives down from Concord. The ambulance picks up my dad. And for those of you in medicine, or even if you're not, there's things called stroke protocols. So what they do now is they zip you to the CT scanner right away, because it's pretty obvious he's having a stroke. So by the time he hits the ER and he sees the doc and everything else, they can treat him. So they did that. So they came down to take him down to San Ramon Valley Regional Medical Center. On the way down, they stopped the CT scanner. Massive left middle cerebral artery stroke, occluded right-sided hemiparesis, blah blah blah. Minute 37, my dad gets TPA, tissue plasminogen activator, right? So it's the clot buster. About an hour later, I'm pulling in because I make the land speed record time from Placerville, and he can actually talk. He's actually moving the right side of his body. And let's fast forward 6 years. He now walks, he talks, toilets himself, cares for himself, bathes himself. He did need to learn how to write with his left hand, but other than that, it basically saved his life and a lot of disability, debility, and despair for the family. So, long story, it's not really part of my subject. Once you give me a microphone, you guys are in trouble. So the bottom line is, the 4 Ds work. Okay, let's not lose sight of this. Okay, this is not traditional medicine bashing here today. This is like embracing good medicine to take care of our patients. And there's a perfect case in point. So for acute critical problems, let's not forget the advent of penicillin and how it cured diseases in our lifetime, and how TPA basically saved my dad. Okay, let's talk about another story. Okay, so there's a mug of this guy. And believe me, I do own more than one shirt, but my wife says that I look really good in this shirt, so that's why I'm wearing it. So you don't need to see that. Quick story about me. I'll try to make it quick. We're gonna go back a little bit further. Let's go back to August of 2012. So I've been practicing integrative medicine, complementary medicine. I believe in red yeast rice and glucosamine and fish oil since 1991, but I really started doing this in earnest about 10 years ago. And in August of 2012, I started getting involved with the Institute for Functional Medicine, which I hope you guys all learn about and follow their guidance. And so I went to their introductory course, 5-day course, Buku Box, AFMCP, Applying Functional Medicine to Clinical Practice. It was at Marina Del Rey in Southern California, 5-day course. And so at this conference, they really want you to buy in and dive in and believe in this stuff. And so as you've learned from the lovely sisters, Drs. Long and Schrock, that gut health is kind of cornerstone, as is nutrition, as is stress reduction. And so, but gut health was kind of the theme that year, August of 2012. So all 300 attendees, they got their own stool kit. Okay, we actually got 2. So I came home, some people come home from a trip and they bring their spouses flowers or something. I brought my wife home a stool kit. So that's a story for another day. So I brought home the stool kit for Katerina and I did it on myself. Okay, so So I sent this, you poop in this little container, FedEx, pre-printed bottle, whatever. Send it back to North Carolina, Genova Laboratories. Am I allowed to say that? Yeah, we're not getting CME. So they call me, so they take your stool and they put it in an incubator and they see what's living inside of you, right? And you want to have healthy gut microbiome, not unhealthy stuff, right? Bifidobacterium and lactobacillus, the good guys, right? Plant the weeds, kill the seeds. So they call me. They called me up and said, Dr. Barley, whose sample was this? And I said, well, that was the freebie. That was my sample. And they said, well, you've got this bacteria called Yersinia growing inside of you, and it's actually listed as a pathogen. It's not just like a dysbiotic thing. You got to get rid of this thing. I'm like, are you kidding me? I mean, I really didn't have a lot of GI symptoms. I just did this because I was playing along, right? And I was buying in, but what's all this all about? So I had Yersinia, Klebsiella, Citrobacter, and I had Candida. I had bacterial overgrowth in my gut. Okay, so again, I'm trying to think, I eat pretty healthy. I mean, I'm kind of into this functional medicine stuff. I exercise. But okay, let's do this thing, right? I'm jumping into the deep end of the pool. So I go through the 5-hour program, the lovely 5-hour program. And in my office, I try to make it simple. So I tell the patients, let's kill the weeds and plant the seeds, and let's give you a lot of fertilizer. So we're feeding you, we're watering you. Let's put the good stuff in your gut. So I did that. Okay, so I did that. So we're August 2012. About, 2 or 3 weeks into it, I felt horrible. I felt horrible. I had like fevers. I had like a sinus infection. I had bronchitis. I was coughing. And I call up our mentor. One of our mentors is Dr. Mark Holdhouse. He's also a guru in functional medicine. I said, Mark, I'm on Cipro. I'm on Flagyl. I'm taking uva ursi and black walnut husk. I'm taking probiotics. And I feel miserable. I'm killing all these bacteria. He says, oh, yeah. He says, Bill, you're having a Herxheimer reaction. I'm like, what? What? You're having a healing crisis. Oh, great. So I had a healing crisis. So I made it through that, felt unbelievable. And then that winter, my bowel movements were like when I was 10 years old again. Not that I really ever remembered that. But things were pretty normal, and maybe my little indigestion was gone. But I didn't think much of it. I thought, okay, I've killed the weeds. I'm doing what I'm supposed to do. Okay, things are good. But I didn't really have a lot of problems to begin with. April of 2013. Okay, for the 40 years that I've lived in California, we moved from the East Coast when I was a kid in 1974. I had unbelievable seasonal allergies. Antihistamines, nasal sprays. Our family doctor down in the Bay Area gave me a shot of prednisone back in the 70s just so I could play on the little high school tennis team in the spring. And they were horrible. April of 2013, my allergies are gone. I have no seasonal allergies, none. I take maybe some antihistamine eye drop, but now that's fast forward 7 years, and killing the weeds and planting the seeds has cured my allergies. Who would have thunk, taking care of Yersinia and Klebsiella and Candida can fix your allergies? Okay, at that point in time, give me I had Kool-Aid, it was all over. I'm doing this stuff full on. I can't explain it. I'm trying to learn how to explain it, but I believe in the 4 Ps. Okay, the 4 Ps absolutely work. They absolutely work. But don't forget my dad, the 4 Ds work as well. And it's kind of all about perspective, right? So, can you fit a square shape into a round hole or a round shape into a square hole? Well, it depends. If we cut this thing in right at the cylinder there so that the diameter is the same as the length, you could make a square and you could fit it through the hole there in the red. If you put a cylindrical hole in the aqua up there, you could put this thing through that way. So it's all about perspective, and I think integrative medicine works. And what is my functional medicine elevator speech? It's really easy. It's medicine that gets you functioning better. Okay, it's easy, right? Everyone's got different physiology. Everyone's got different needs and requirements. But if we get you functioning at your optimum, game over. That's it. That's all we can do, right? Simple. And that's what functional medicine really looks at. So remember, it's all about the 4 Ds and 4 Ps, and then at the end, you're going to learn about the 4 S's, okay? So that's my little sidetrack. I'm only given 45 minutes or 50 minutes, and then when you go to functional medicine conferences, we talk really fast because there's so much up here that we feel like we've got to get out. It's like drinking from a fire hydrant. So I apologize if I go really fast, but and I definitely digress there, but I wanted you guys to see a little foundation as to where I'm coming from you. So, okay, let's look at the integrative approach to what I've been tasked to talk to you about, which is diabetes and cardiovascular disease. Okay, so if we go to the American Academy of Clinical Endocrinologists, these great people that are MDs mostly, that are endocrine. They've put together this unbelievable algorithm. And this is, of course, the 4 Ds, right? Diagnosed disease. Okay, you got diabetes, your sugar level's high. Let's dispense drugs, okay, right? That's what we're really good at. It worked for my dad, right? So there's all these things that you can give. Now, I do have to give them credit. You know, lifestyle therapy is kind of the first line, but I have to tell you, after having been board certified and teaching and practicing family medicine for, almost 30 years, it's kind of lip service in the traditional medicine world, as opposed to the functional medicine world where it's like the mainstay. I mean, it's the cornerstone. But they do talk about lifestyle therapy, but I can tell you 9 times out of 10, most traditional docs jump right into drugs, right? The 4 Ds. And they've got this unbelievable algorithm. We can teach PAs how to do this. We can teach medical students how to do this. This is really easy. And then we've got this incredible list. Like, oh my God, all these drugs are coming out. And, I know many of you are undergraduates. And so, it's beyond me to tell you the mechanism of action of all these things. But, when I was training, there was basically sulfonylureas and some TZDs. Now there's like all these things here. We had a discussion about insulin from Dr. Burke. That's kind of the end of the line if we have to put you on insulin. But I can tell you this, the 4 Ds work. So in a traditional practice, if you've got A1C elevation, if your sugar level is above 125, they're not going to make some dietary changes. You got to get their sugar level down. The 4 Ds absolutely work. Or do they? So key points regarding this. They're very effective. Okay, so we lower your sugar level. We can do that. We know how to do that, right? We go to the kidneys and we block this thing called the SGLT2 reuptake inhibitor, so you pee more glucose out, so your body sugar goes down. I mean, we can manipulate the body to lower your sugar level, but at what cost? So, again, the sisters, I think Dr. Schrock was saying earlier, we can eliminate symptoms, but we don't necessarily cure disease. Well, in this case, we can eliminate a sign, high sugar, but we don't really cure the disease. And so, and not only that, to take it a step further, I challenge you to look up the New England Journal of Medicine article 2008, the ACCORD trial. So pretty revolutionary. They took a lot of patients, like it was over 1,000 patients, I think it was 4,000 patients, and these were fairly well-controlled diabetics, and they made them ultra-controlled diabetics. So their A1Cs were, 6.5 or 7.2 for entry into the study. And then, they made them ultra-controlled. They got their A1Cs below 6.5. And I can't remember for what period of time they followed them. But the bottom line is the group that was ultra-super-controlled sugar had increased all-cause mortality than the patients where we didn't do ultra-glucose control. Okay, so do the 4 Ds work? Okay, yeah, we can lower a sign or a symptom, but to what cost, And so at that point in time, now that was 12 years ago, it seems like yesterday, but now all these new algorithms have come out and they said, well, tight glycemic control is really probably not as good as we thought it'd be. Keep the blood sugar A1C level above 7. Okay, so that kind of changed the tune based on this really well thought out prospective trial. So again, the 4 Ds work, but at what cost? Well, it costs billions of dollars, right? So diabetes across the United States, billions of dollars, we're talking hundreds of billions of dollars. When you think about job, loss of days work, loss of work days, and then if we just look at the amount that you lose from drugs alone or the cost from drugs, that's probably in the order of tens of billions of dollars. And again, if we lower the sugar level too much, maybe that's not a good thing. And are we really putting a Band-Aid on the problem? Were you born with a deficiency in metformin? Were you born with a deficiency in sulfonylurea? Not really. We know these medications can work, but wouldn't it be better if we could just do some lifestyle changes, maybe the 4 Ps, and we could fix the problem? So there's the 4 Ps. So let's talk about the 4 Ps, again, in the integrative approach to diabetes and cardiovascular disease. Well, one thing I want to make clear is, although we believe in supplements and nutrients and phytochemicals, we don't want to just replace pharmacy with what we call green pharmacy, okay? So as functional medicine docs, we don't want to just give you a bunch of cinnamon and vitamin D and magnesium because that stuff works to lower your sugar level, just like we would give you metformin and sulfonylureas. So we have to be careful about that. So yeah, to improve sugar uptake in the muscles, we know cinnamon, magnesium, vitamin C, they all work to at the skeletal muscle to increase insulin sensitivity. So sugar is taken into the cell better. We know alpha lipoic acid, omega-3s, vitamin D, they work. We know at the pancreatic level, vitamin D, cinnamon, GTE stands for green tea extract. All these things work, okay? In the liver, just like we can give metformin to decrease the production of glycogen breakdown into glucose, we can give green tea extract. It works. But again, I challenge you, were you born with a deficiency in green tea extract, right? Now, I will make one caveat. If you are deficient in some of these nutrients, and then we replace them, remember the 4 Ps, 4 Ds, functional medicine, get your body back to physiology, then we're actually making your body physiologic, and then it can metabolize the sugar better. So Dr. Gomez could probably tell us, but depending on where you read, 40 to 80% of us are deficient in magnesium, right? So magnesium, an apple from 1920 and an apple from 2020, it does not have the same amount of magnesium in it, and that's due to crop rotation and soil rotation and all that kind of stuff. So the bottom line is, if you're deficient in magnesium, and I test all of my patients, and most of them are deficient in magnesium, and then I give them magnesium, well, I'm not really giving them green pharmacy. I'm fixing a problem, getting them to physiology. And yes, if they can get it through diet and exercise, that's better, but then we have a problem getting it from the nutrients. So again, just to be clear on that, when we talk about the 4 Ps, do not get mistaken for green pharmacy. So the 4 Ps, as far as diabetes is concerned and cardiovascular disease, and I'll explain how that kind of connects, really can be summarized as the 4 S's. Remember, I told you just remember 3 letters of the alphabet for me today, and it's a home run. So the 4 S's, and you've heard these already, so being the second to last speaker of the day, I got that going for me. So the first S is the standard American diet. Well, the standard American diet is bacon, meat, eggs, cheese, fried foods, French fries, ranch salad dressing, mayonnaise. It's cookies, cream, fudge, and brownies, and donuts, and rolls, and scones, and muffins. And nowhere in there did I say fruits and vegetables. So we call that SAD, right? That's the standard American diet. But that's the first S. We don't like the first S if we're trying to do the 4 Ps. Sedentary lifestyle. Lack of exercise. So we know exercise increases the GLUT4 receptors in your muscle cells. You take up more sugar. We lower your sugar level. We can prevent diabetes. We've talked about sedentary lifestyle. Excellent lecture this morning from Russell. Stress. Excellent lecture from Dr. McCarthy. All about stress and the main job of cortisol. Okay, so stress leads to cortisol. Is to get sugar available for our brain so we can survive that saber-toothed tiger chasing after us from the jungle. And so high stress and cortisol leads to high sugar. So if we start addressing these things, we can lower your sugar level. Again, the integrative approach to diabetes and cardiovascular disease. And it's one thing if a saber-toothed tiger is chasing after us, but it's another thing to live in 21st century America, whether you're a Trump fan or Obama fan or left side of the aisle, right side of the aisle, or CNN or Fox or in-laws or outlaws or taxes or death. I mean, we have stress. We just have stress. And so that's going to lead to high cortisol and high sugar. And then sleep. So sleep and lack of quality sleep, that's been mentioned earlier today as well. So when you have problems with sleep, you have high cortisol levels. Okay, another digression. So October of last year, I go see my dentist, and he's like, hey, there's some changes here. You're grinding your teeth, and sometimes that can be associated with sleep apnea. Do you think you have sleep apnea? I'm like, well, Katerina says I snore, but, she's never witnessed me stop breathing. So Dr. Anderson says, we'll just take this little thing home, and we can see if you have sleep apnea. I'm saying, hey, I'm all for it. That's totally fine. So I take it home, and so, I don't know, the week later he calls me back, and he says, well, here are your numbers. So I had an AHI of 29. Does anyone know how significant that is? Yeah, so I'm like on the border of severe sleep apnea, right? So AHI means your apnea-hypopnea index. So in a given hour, that number 29 means 29 times, so basically every other minute, I stopped breathing, for all 8 hours while I'm sleeping. Es no bueno. This is not good. And so yours truly, November 1st, we call it the nose hose, right? So I got the nasal pillows. I look really sexy. I've got this thing coming out. We plug it into the machine, and I got 7 centimeters water pressure, keeping my airway open at night. So since November 1st, I've always slept pretty well, but I sleep unbelievably, and I wake up in the morning completely refreshed. And so it's been kind of an eye-opener for me. Even some guy who's totally into his health, I had silent sleep apnea, right? So it's out there, and we have to look at that in our patients. Okay, so there's the 4 S's, which are kind of a sub-branch, right, of the 4 P's. So what's the take-home message? The 4 D's, the 4 P's, and the 4 S's. And that is pretty much it regarding an integrative approach to cardiovascular medicine. And I'm like 30 minutes ahead of time. But she's paid me, and you guys have paid a lot of money, for a little bit more in this lecture. So I'm going to continue, and we're about halfway through. That's kind of my point, to say I'm halfway through. So we're really doing well for our time here today. And I'm not going to stop right there. Let's dig a little deeper, and let's go back and look at some other things here. Okay. So I've been tasked with kind of telling you about the integrative approach, remember Dr. Smith and Dr. Jones, to diabetes and cardiovascular disease. And how in the heck, diabetes, high sugar level, and cardiovascular disease, I mean, how are these things related? So I'm going to try to explain that to you. And really, I'm not that smart. I talk really fast, but I'm not that smart. So if I try to explain this to you, I'm going to really use simplistic terms, because that's on me. Okay, now first off, I want to tell you that we're going to talk about garden variety adult onset diabetes. This is a totally different kettle of fish than insulin-dependent diabetes, juvenile onset diabetes, or this thing called LADA, latent autoimmune diabetes of adulthood, which is real. And we see it a lot. People are actually making antibodies against their islet cells and against insulin and against this enzyme called GAD. And these people need insulin, and I do all my lifestyle stuff with them, my 4 S's till the cows come home, I fix their gut, and their sugar levels are still high, and I'm like, oh, dude, I don't know what's going on. So I do these antibody tests, and so these people actually probably need to end up being on insulin, or we aggressively treat the autoimmune disease. But for the purpose of the rest of this lecture, I'm talking about the majority of people who have garden variety type 2 adult onset diabetes. And this is real. Now, Dr. Burke was telling us in the United States, a third of people in the United States have diabetes or prediabetes. Well, I'm going to one-up her, but I was looking, this is a year earlier. No, yours was 2014, 2015, 17. So this is at our alma mater. A bunch of us were from UCLA. Great place. Davis is great, too. My wife did all 10 years here. So March of 2016, this is from UCLA Center for Policy Research. Look at this. Where is it here? Somewhere here. 55% of Californians. Is that right? That's right. So we're worse than the country. Yeah. So it's better to live in Montana than here. No. So 55% of Californians either have prediabetes or diabetes. And truth be known, last year, before I knew I had sleep apnea, one of the 4 S's, my sugar level was 101. Holy crap, that's in the pre-diabetic range. Now, my insulin was good, my A1C was good, but technically, I'd be that, one and a half of us. You could have said last year I had prediabetes. It's since normalized, so don't worry, I'll be okay. But bottom line is, this is a real thing, and a lot of us have this here in California. So diabetes, cardiovascular disease, it's real. A lot of us here in California have it, and I want you to think of it as a spectrum of disease. And so, kind of a busy slide here, but the green side of the slide is good. Your sugar level's normal, your A1C is normal, your cholesterol's normal, your blood pressure's normal, you got physical activity. And then as you go along the spectrum, you go onto the right side there, that's the not good side. And so you develop things like diabetes, and your LDL goes up, and your triglycerides go up, you're physically inactive, and then we lead to things like sudden death and heart attack. So it is a spectrum, and then prediabetes kind of lives along that spectrum there too. So in the functional medicine world, we kind of see this whole thing as a spectrum, and I'll try to explain how that spectrum kind of comes together even more. Okay, now I'm going to digress a little bit. So is it inflammation or is it high sugar? So high sugar is pretty easy. We eat too much sugar-rich foods. We don't exercise enough. We have sleep apnea. We have too much stress. Dr. McCarthy told us stress increases our cortisol, which increases our sugar level. Okay, we get all that. But then we've also learned about inflammation. We've learned about reduced oxygen species. We've learned about toxins, lack of exercise. So fortunately, this hasn't been taught to you yet, so I get to teach you something. So there's something called AGEs. Okay, so you've got sugar floating around in your body, and you've got hemoglobin floating around your body, and a bunch of other proteins. And they decide to irreversibly bond. And so they form this molecule called glycohemoglobin. It's called the A1C. And that hemoglobin molecule lives for 90 days, so we can have an assessment of what your sugar level is over those 90 days by measuring your glycohemoglobin level. Well, the glycohemoglobin level is an age. It's an advanced glycation end product. Okay, so it's one of the ages. We have a ton of them. A lot of proteins get bound up with sugar. And when that happens, that's not good, because the body shouldn't have a whole bunch of extra sugar floating around. And when it attaches to these proteins, it makes these molecules that our body's not used to, and it doesn't really like that. And so, so what happens is, you got these little cells, and these little cells are like, picking off the glucose that comes around, and insulin binds to it, and insulin activates the GLUT4 receptors, so you take in more sugar. But then that little cell is looking out there, and it sees this age, this advanced glycation end product. And it's like, whoa, that doesn't look like insulin, that doesn't look like sugar, that shouldn't be that so much of that out there. So over the millennia, we've developed these things called RAGEs. RAGEs are receptors for advanced glycation end products. So that little cell has this little antenna out there, and that little antenna is sensing the environment. And when it says, oh my God, there's all these ages out there, that is not good. Things are not good. Cats and dogs are living together. This is just not good. And so that little cell kind of shivers up a little bit and says, you know what? I'm not going to take in sugar right now. I'm going to kind of see what the lay of the land is here. So that receptor kind of signals for that cell to calm down a little bit and slow down. And so the sugar levels go up even more, because now there's these ages. Well, then the sugar level goes up, and then you're under stress, and then you have toxins, and then you're not eating enough fruits and vegetables. You get oxidative stress. Sugar level goes up even more. You go to Frosties and you get a Frosty, and your sugar level goes up even higher. And so it kind of is a vicious cycle, and that rage gets activated, and then that leads to some other things that happen inside of the cell called cytokine release and inflammatory molecules. And so when the rage gets activated, you release these things called interleukins and cytokines, and those go down to the nucleus, and the nucleus is like, well, man, something's going on out there. This is not good. So it sends more signals up to the membrane, and so your insulin receptors become insensitive. And so the whole thing is kind of, yeah, we got too much sugar, but then it's also too much inflammation. And the inflammation can be from various sources. Again, Dr. Schrock and Dr. Long told us about the gut permeability and lipopolysaccharides and dysbiosis. That leads to inflammation. Lack of antioxidants from our diet, that leads to inflammation. Toxins lead to it. Lack of exercise. So again, it's all this big gamache. It's not just we eat too much sugar and don't exercise enough. There's also inflammation going on. So it's kind of both. It's both diet and the 4 S's as well as inflammation. So I'm not going to drink this, although I'm a little bit parched. This is made with real sugar, okay? So at least I didn't bring the one that had the non-sugar substitutes that we learned about are not good for you. So if I am going to drink this on the way home, which I might, it's made with real sugar. So I do tell you, if you're going to drink something that has sugar in it, do the real thing. Don't do aspartame. Don't do stevia. I don't know, stevia's probably okay. But the sugar substitutes, the body doesn't know what to do with them. And so it just sends out more insulin. And so then you become more insulin resistant because there's nothing for the insulin to work on. But if I at least have this, the insulin has something to work on. Okay, so at least that's my reason for having this, if I do have it, but I might not. Okay, if I open this up, and I pour this on the counter here, which I'm not going to do because the Monday professor really wouldn't like me here at UC Davis. So if I pour this on the counter here, and let's just say I took a little towel and just kind of got the majority up, but I really didn't scrub it off, right? So let's just say that the Pepsi with real sugar residue was kind of here for, I don't know, 10 minutes or something. If I came back in 10 minutes, what would this surface be like? Yes, it would all be kind of sticky and gummy. So this is the explanation I use my patients. I tell my patients, I say, listen, I say, Mr. Smith, you got way too much sugar in your body, and your sugar levels are high, your insulin levels are high, and this is what happens. You know, the surfaces inside of your body are just totally gummed up. Everything is just gummed up. Nothing is working well. So you're going to get diabetic retinopathy, and you're going to get blocked arteries to your heart. That's a heart attack. Blocked artery to your brain. That's a stroke. You're going to get kidney problems. You're going to lose your foot. These are just not good things. So you've got to fix this high sugar level. Let's ungum the works. So that's my demonstration a little bit there without actual live demonstration, because I didn't actually practice that. So it all starts with sugar, high insulin, inflammation, this insulin resistance, the ages and rages, and then this then leads to things like prediabetes, elevated triglyceride, dyslipidemias, non-alcoholic fatty liver disease, hypertension, cardiovascular disease. It's all this family, okay? I'm gonna take you on one more little trip, and then I promise you I will be done. And on this trip, I'm gonna try to explain to you how sugar, inflammation, insulin, these cytokines that are being released, high sensitive C-reactive protein, I mean, how does all that lead to exactly? How does that lead to non-alcoholic liver disease? And how does that lead to high cholesterol? I don't get it. So I want to introduce you to a friend of mine. This is Mel, okay? Mel is a cell, okay? Now, Mel is not only a cell, he happens to be a muscle cell. Okay, so Mel the muscle cell is really good at taking in sugar and turning that sugar into ATP and making energy and contracting and doing all the things that they do. So in a perfect world, sugar hits Mel, Mel turns that into energy. I don't know what happened there. Don't try this at home. So yeah, so it turns into energy. So that's with normal metabolism. Let's look at abnormal metabolism, which we've been talking about. So now if you have too much sugar because of all the 4S's and toxins and all the other things, then poor Mel down there, he's like, whoa, the rages, the insulin receptor, insulin resistance. He's like, no bueno. He doesn't take in the sugar anymore. His metabolism goes to pot, and so that leads to poor energy, continued high sugar levels, insulin resistance, your insulin level goes up, you got these ages floating around, you got these rages floating around, the rages, the receptors. The rages are activating all these inflammatory cytokines, so you've got like interleukin-6 and tumor necrosis factor floating around, and that leads to high sensitive C-reactive protein. It's just not good, okay? So it all starts with this. Remember our little friend Mel, okay? Now Mel has a buddy, okay? Mel's buddy is Del, okay? Del is a fat cell. Okay, now Del lives down in the belly, okay? And Del says, hey, Mel, I can help you out here because this is my job. My job, when there's too much sugar and there's too much insulin, I can turn that into triglycerides and I can store it as fat cells, fat in the cells. So thank God Mel has his buddy Del, okay? Del takes this excess sugar, turns into glycerol, and then we've got too much of free fats floating around, so they combine that, and they make these things called triglycerides. Triglycerides are kind of the fat storage molecule. As we learned earlier, we don't have a lot, or fat cells don't necessarily make more of themselves, but they can get bigger. And so they can start getting bigger. And so Del starts taking in all this stuff, helping his buddy Mel out there while you're up there not listening to the 4S's. And so Del takes in all this stuff. Well, at some point in time, Del says, enough. I just can't help you anymore. I just cannot do this. And then Del starts having excess triglycerides. Del literally, like, King Henry kind of blows up a little bit. And then so triglycerides are floating around, and there's inflammatory cytokines floating around, and interleukins floating around. Del lives in this place called visceral adipose tissue. They actually release things like called angiotensin. That's something that raises your blood pressure. So now your blood pressure is going up. See how this is tying together again? So Del has another friend. Okay, now, they don't like me talking about this, but Del's friend was his girlfriend, and she lives up in the liver, and her name is Belle. Okay. Well, they dated a long time ago, and they don't like me talking about this because they were young. They were just stem cells back then. And so Belle's up in the liver, and when they broke up, and Del was really willing to do the long-distance relationship because she's up in the liver, but Belle didn't want to. She didn't want to do the long-distance relationship. But she did say to him, as many ladies told me back in my dating days, JWTBF. JWTBF. Del's like, what are you saying? She says, well, listen, this isn't going to work, but I just want to be friends. I just want to be friends. So Del remembers this, okay? And Del says, I'm really in dire straits here. I'm going to call up Belle, and you can see I go like this, 1970s, not like this. Call up. So calls up Belle up in the liver and says, hey, I'm really in dire straits here. I've got too much stuff happening here. So Belle says, I can help you out. I can help you out. So now in the liver, Belle does some things. Okay, so she takes up these triglycerides. And Belle's job, she learned this after she became a progenitor cell. She actually knows what she's doing. She actually transfers these triglycerides into these triglyceride-rich particles. And these are called like IDLs and VLDLs and LDLs, cholesterol packets. So she's really good at that. And then she starts shipping these things out, right? So the circulation, so now you're seeing how all this stuff is kind of tying together. So now this patient's cholesterol level is starting to go up, right? High LDL, those kind of things floating around, VLDL. And then even Belle gets a little overwhelmed, and she's like, what am I gonna do with all this stuff? So she starts storing some of it in the liver. Well, that's called non-alcoholic fatty liver disease. Okay, so these things are all kind of happening, and you see how this thing all comes together. And there's one more friend, and that's L. And L lives in the endothelium, okay? Now, unfortunately, when things get overwhelmed to this extent, now L has to start taking some of this stuff up, mostly the triglyceride-rich particles called LDL particles, especially the small LDL particles. And she's not really designed to store these things, but she does. And so then you get some thickening of the lining of your arterial walls, and then that leads to things like hypertension and strokes, God rest your dad, and heart attacks and all these kind of things. So now you can kind of see this whole spectrum. And Barley's talking about diabetes and cardiovascular disease. How do they connect? Well, they connect by the four friends, Belle, Del, Mel, and L. And you kind of understand how it all works. But it all comes down to the four S's that they weren't following. So let's review. If you give Mel the bad stuff, those are the four S's: sedentary lifestyle, stress, sleep problems, standard diet, then metabolism is not good, it leads to all sorts of problems. If you give Mel the good stuff, okay, so instead of the SAD diet, we talk about something called the GLAD diet, green and lean, anti-inflammatory diet. And I like to talk to patients about plans, because I like diet plans, because the first three letters of plan are play, and I think food should be fun. The first three letters of diet are D-I-E, S not as good. And so I talk about the GLAD diet, or the GLAD plan: exercise, stress reduction, good sleep, and then Mel is a happy dude, and he makes energy. So it's all about balance, right? You got to put exercise in there. You got to eat your GLAD diet. You got to find your Zen, meditation, yoga, Tai Chi, Dr. McCarthy stuff. And cats and dogs can sleep together and live together. Hard to see it, but there's a cat in there. And so sleep is very important. If that light bulb doesn't go off and you don't have the insights, then that truck goes through the stop sign, you have a train wreck, you have a car wreck, you continue to eat those. My dietitian calls those foods anti-nutrients. I'm like, Chelsea, what's an anti-nutrient? She's like, well, you're taking all these things in, and they need to be processed. And so you're using up like all your B vitamins, and you're using up magnesium, and they absolutely replace nothing. And so they're literally anti-nutrients. I said, that's pretty good. I'm gonna use that in a lecture someday. So I just did. So that's pretty good. Chelsea now is their dietitian. They stole her from me. That's okay. But if you have inflammation, then these lead to problems. And then, of course, ultimately leads to a heart attack or stroke. Okay, quick case presentation. Are we doing okay? Thumbs up from the director here. So case presentation, true story, didn't make this up. So ML also said I can use her name, but I said I'd use her initials. So she's a 31-year-old young lady. I've actually known her for almost 20 years. She was a teenager, so probably 12 or 13 when she, maybe 14 when she moved up to the United States. So I've known her for quite a while. She's now 31. I don't know the entire background, but she was living south of the border. She was in a family situation, maybe a boyfriend situation at 15. Something was not good. And the family said, okay, this is just not working out. You need to go live with your aunt up in Placerville, California. And so at a young age, again, I think she was 15, she moved up across the border into our area, Placerville. So I had been her mom's doctor for years, her aunt, and she said, would you take on ML as my patient? I said, absolutely. So I've known her for a long time, but I haven't really seen her a lot because she's a healthy 18-year-old or 17-year-old, 21-year-old. She's now since gotten married. So I've known her for quite a long time, but not a lot in the office. So she came to me not long ago, last summer, and she was very, very worried because her father had diabetes at a young age. So he had diabetes at age 30, and she was 31. And so she was kind of worried because she was kind of having some symptoms, maybe increased urination, maybe some sugar craving. And so she wanted to be investigated. I said, hey, you came to the right place. I know all about this stuff, so let's talk. So in my office, I have this thing called a diet score, and it's just my quick and dirty way of having a patient fill out a questionnaire and kind of see how well they're eating. Now, it's not perfect science. It's not validated or anything else, but it just tells me, do they drink more water or do they drink more Coke? Do they have more ice cream or more fruits and vegetables? Do they eat fish? Do they eat red meat? Do they eat fast food? It just kind of gives me a ballpark. So that spectrum of that score can be -25 up to +25. Okay, yours truly scores about 12 to maybe 15, depending on if I went to Baskin-Robbins that week. But generally, anything above 10 is pretty good. You're drinking more water than soda. You're eating more fruits and vegetables. You're not eating fast food. You're eating more chicken and fish. This lady scored -9. I don't know if you can see it, but she scored -9 on my diet score. That's not the record. I had some dudes living up in Pollock Pines that were going to college down at Folsom, and they said, Dr. Barley, you wouldn't want to see what's in our refrigerator. It's like leftover KFC, leftover McDonald's, and leftover Pizza Hut, and they had mold on them. They scored -20 on my diet score. So ML was not the record holder, but -9 is not good. So low-hanging fruit here. She was not eating a healthy diet. The only people in my office that have scored consistently above 20 was my dietitian, Chelsea, that she stole from me. And so Chelsea scored 22 on the diet score because she eats ridiculously healthy. She has like quinoa for lunch and she's like satisfied. That doesn't satisfy me. But she scores very well. ML did not score high on the diet score. And to the point, she had one fruit or vegetable per day. In a given month, okay, let's get that right. In a given month, 30 days, she had maybe 5 different fruits or vegetables, okay? Even I do better than that. She had cake or cookies daily, and then she went to fast food 3 times a week. Okay, so again, breaking down that diet score, okay, things not looking so good. Okay, so her fasting insulin level is 23. Now, normal is less than 8. I mean, some of the functional medicine doctors want it to be like 6. I don't even know what the reference range is on it, but 23 is just not good. I mean, she is knocking on the door of diabetes. Her sugar level was 97. Now, normal by the reference range at our lab is 70 to 99. 99 is not normal, okay? 97 is not normal. We really want you to be 75 or, down there. We don't want you to be hypoglycemic, but 97 also knocking on the door of diabetes. Okay, now more importantly, dang, her ALT and AST. So a lot of you are undergraduates, so these are liver function tests. And in the functional medicine world, for a young, healthy female, these should be 20 or less, okay? So these are liver function tests. So her ALT, twice that, AST bumped to 27. So yes, she could have all these other causes of elevated liver function tests, and we could go into that. We could talk about diagnosed disease, dispense drugs. But the bottom line is she probably has non-alcoholic fatty liver disease. And I said, okay, listen, ML, you got to make some changes. Fear of God, come to Jesus. Let's have a change. And so that was June of last year. And so she listened to what I had to say. I'm going to digress for a second like I've done all day. One thing we haven't really talked about is motivation. And so one of the things that's not in the functional medicine matrix, but is in my matrix, is how motivated are these patients. So everyone in this room is extremely motivated. You wouldn't be here if you weren't. But when you're out there on the front line seeing patients, and I've seen 3,000 patient days a year for 25 years, a lot of people say, hey, Barley, give me the 4 Ds. I mean, I'm paying you the bucks for this. I want the 4 Ds. I want metformin, tell my wife my sugar level's fine, and I can still have my ice cream every day. So I think what we really have to maybe step back on, and I'm digressing here, but is actually motivating people, right? So James talked this morning about, how do we apply this in the real world, and in some places it's not possible to do this. Well, one of the biggest things we got to overcome is patient motivation. So a lot of my job is being a cheerleader for them. Fortunately, this young lady, with her father's fear, she had motivation. Came back and saw me with significant dietary changes, started an exercise program, stress reduction. My 5th S, by the way, from James, the 5th S is, oh, damn, I wrote it down. Solitude. Solitude, that's the 5th one. So isolation or solitude, not good. So this lady got back together with her husband. She needed to get back on the same page with him and have more conversations. And so her relationship got a lot better. So maybe that was part of it too. But she did change her diet. In November, she came back and saw me. Okay, so now her diet score is 7. Okay, you're thinking, well, shit, that's nowhere near 20. It's not even above 10. But to go from -9 to 7, it was a huge change for this lady. And so, for example, now she was eating 3 fruits and 2 vegetables every day. In a given month, she said 8, but I know she's having more than that. So in a given month, she has 8 different fruits and vegetables. Remember, Dr. Berg was telling about the colors of the rainbow. She only has fast food once a week, not even that at this point. And the cookies and cakes were a weekly treat, a Friday treat with her husband. So huge changes. And now, in 4 months, check out these numbers. So now her insulin level is 11. I mean, it went from 23 to 11. Now, it's still not 8, but, remarkably better. Sugar level is 86, so down 11 points. But the most important thing to me is she no longer has non-alcoholic fatty liver disease. Now, yes, they're still technically above 20, but in the reference range, that's normal. And to cut those liver function tests down that much is absolutely huge. So that is really that. What are the 4 take-home messages? What are the 3 letters of the alphabet? This is the audience participation time. Yeah, PD and S's. PD and S's. That's it. That is all you have to remember. This stuff absolutely works. I wish you luck in your medical journey, and thank you for being here.